HIV, or human immunodeficiency virus, is a virus that attacks the body's immune system. If left untreated, HIV can lead to AIDS, acquired immunodeficiency syndrome. HIV is spread through bodily fluids, such as blood, semen, vaginal fluids, and breast milk. The most common way to get HIV is through unprotected sex with an infected person. HIV can also be spread through sharing needles or syringes with an infected person. Drug abuse, including injection drug use, is a major risk factor for HIV infection. People who inject drugs are at increased risk of HIV infection for several reasons. They may share needles or syringes with infected people. They may have open wounds that can come into contact with infected blood. They may have impaired judgment and engage in risky behaviors, such as unprotected sex. In addition to increasing the risk of HIV infection, drug abuse can also make it more difficult to treat HIV infection. Drug abuse can weaken the immune system, making it harder for the body to fight off infections. Drug abuse can also make it difficult to adhere to HIV treatment regimens. How drug abuse can increase the risk of HIV infection. There are several ways in which drug abuse can increase the risk of HIV infection. Sharing needles and syringes. Sharing needles and syringes with an infected person is the most common way to get HIV from injection drug use. Even if the needles and syringes are supposedly clean, they can still contain traces of infected blood that can transmit the virus. Engaging in risky sexual behaviors. Drug use can impair judgment and lead people to engage in risky sexual behaviors, such as unprotected sex with multiple partners. This can increase the risk of HIV infection through sexual contact. Entering into sex work. Drug users may enter into sex work to obtain drugs, which can further increase their risk of HIV infection through unprotected sex. Having open wounds. Drug users may have open wounds from using needles or syringes, which can come into contact with infected blood and transmit the virus. How drug abuse can make it more difficult to treat HIV infection. Drug abuse can make it more difficult to treat HIV infection in several ways. Weakening the immune system. Drug abuse can weaken the immune system, making it harder for the body to fight off infections, including HIV. Interfering with HIV treatment. Drug abuse can interfere with HIV treatment by causing side effects that make it difficult to adhere to the treatment regimen. For example, some drugs can interact with HIV medications, making them less effective or causing dangerous side effects. Increasing the risk of opportunistic infections. Drug abuse can increase the risk of opportunistic infections, which are infections that are more likely to occur in people with weakened immune systems. These infections can be serious and even life-threatening. Preventing HIV infection among people who use drugs. There are several things that can be done to prevent HIV infection among people who use drugs. Needle exchange programs. Needle exchange programs provide clean needles and syringes to people who inject drugs. This can help to reduce the risk of HIV infection by preventing the sharing of contaminated needles and syringes. Medication-assisted treatment (MAT). MAT is the use of medications to help people with substance use disorders. MAT can be effective in reducing drug use and preventing HIV infection. Pre-exposure prophylaxis (PrEP). PrEP is a medication that can be taken by people who are at high risk of HIV infection to prevent the virus from taking hold in the body. Harm reduction. Harm reduction is a set of strategies that aim to reduce the negative consequences of drug use without necessarily stopping the use of drugs. Harm reduction strategies can include providing safe injection sites and counseling on safer sex practices. Educating drug users about HIV prevention. It is important to educate drug users about the risks of HIV infection and how to protect themselves from the virus. This education should be provided in a non-judgmental and culturally sensitive way. Educating drug users about HIV prevention can help to reduce the number of new HIV infections among people who use drugs. HIV is a serious illness, but it is preventable. Drug abuse is a major risk factor for HIV infection, but there are several things that can be done to reduce the risk of infection. By educating drug users about HIV prevention and providing them with access to clean needles and syringes, medication-assisted treatment (PrEP), and harm reduction services, we can help to prevent HIV infection among people who use drugs. If you are a drug user, it is important to get tested for HIV and to talk to your doctor about HIV prevention options. There are many resources available to help you protect yourself from HIV infection.